All right, today we are diving into a drug called Enoxaparin. You may have heard of it, but what's amazing is how this one medication has totally changed the game for treating and preventing one of the biggest dangers in medicine, blood clots. Let's get right into it.
I mean, think about it for a second. It's a huge balancing act, right? Your body needs to clot to stop you from bleeding out. But if that system goes haywire, the clot itself can be deadly. So the real trick is finding a drug that can walk that incredibly fine line. And that's exactly what we're going to unpack today.
So, here's our roadmap. First, we'll look at the problem itself, this thing called the clotting cascade. Then we'll put the old-school solution, heparin, head-to-head with its modern upgrade, enoxaparin. We're going to get into the nitty-gritty science of its key advantage, see what that actually means for patients, and then wrap up with how it's used safely out in the real world.
Okay, first things first. Let's set the stage. Our bodies have this amazing, built-in system for plugging leaks. But that system is so powerful that it absolutely needs a set of brakes to keep it from just taking over.
The best way to think about it is like a chain reaction, or a series of dominoes. One protein, a clotting factor, gets activated, and it triggers the next one, which triggers the next, and the signal just gets amplified like crazy until, boom, you have a solid clot stopping the bleed. It's a truly incredible process when it works right.
But here's the scary part. What happens when that cascade kicks off without an actual injury? Or when it just doesn't know when to stop? That's when you get these really dangerous clots forming inside your veins, like a deep vein thrombosis, or DVT. And if a piece of that breaks off and travels to your lungs, well, that's a pulmonary embolism, and it can be fatal. This is exactly why we need drugs called anticoagulants.
For decades, the go-to drug to hit the brakes on this cascade was heparin. But, science marches on, and we figured out a way to take that old tool and refine it into something much, much more precise.
Now, standard heparin was a total game changer, no doubt about it. It works by giving a massive boost to the body's natural clot-blocking system. But because its molecules were all different shapes and sizes, its effects were super unpredictable. It was kind of like using a sledgehammer when you really needed a scalpel, and it meant patients had to be in the hospital for constant monitoring.
So this slide is where it gets really interesting. What scientists did was pretty brilliant. They took those big, clunky, unpredictable heparin molecules and basically chopped them up into smaller, much more uniform pieces. That's what Enoxaparin is. It's these smaller fragments. And this one simple change in size, well, it's the secret sauce behind everything that makes it a better, more predictable drug.
So the big question is, how does being smaller lead to being smarter? Well, it all comes down to which specific domino in the clotting cascade the drug decides to knock over.
Okay, so both of these drugs work by supercharging a natural protein in our blood called antithrombin 3. You can think of antithrombin, or AT3, as the body's own little police force for the clotting cascade. What heparin and enoxaparin do is hand it a megaphone, letting it shut down two of the main troublemakers in the cascade, factor 10A and factor 2A, which you probably know better as thrombin.
And this quote right here, this explains everything. To shut down that really powerful thrombin molecule, the big, standard heparin molecule has to be long enough to physically grab onto both the AT3 and the thrombin at the exact same time. It has to form this physical bridge to link them together and shut it down. But remember what we said about enoxaparin? Its molecules are short. They're just not long enough to build that bridge and grab onto thrombin. So while they're still great at boosting AT3 to block factor XA, they have almost no effect on thrombin. This is what makes its action so much more focused and targeted.
And that brings us to this number, 4:1. This is the magic ratio. Enoxaparin is roughly 4 times better at blocking factor XA than it is at blocking thrombin. And that is the key. By hitting factor XA earlier in the chain reaction, it stops the whole process before it really snowballs. This smarter, more targeted action is exactly why it's so predictable and why it completely changed how we treat patients.
So, all that science is pretty cool, but it's not just some fun fact for a textbook. This targeted mechanism translates directly into massive, real-world benefits for both doctors and, more importantly, for patients.
Because its action is so predictable, doctors can dose it just based on a patient's weight. No more constant, painful blood tests. It has way better bioavailability, which just means about 90% of the drug actually gets absorbed and does its job. It also lasts longer in the body, so you need fewer shots. And crucially, it has a lower risk of a really nasty side effect called HIT, where the body has a dangerous immune reaction to the drug. You put all that together, and what does it mean for the person who's actually sick? It's totally transformative. It means patients can often go home from the hospital sooner, give themselves the shot once or twice a day, and get back to their lives. It means more comfort, more convenience, and a whole lot less time stuck in a hospital bed.
Okay, so let's get practical. How is this powerful tool actually used? Because like any powerful tool, you gotta know the user manual to use it safely.
Honestly, enoxaparin is a real workhorse in modern medicine. It's used to treat clots that have already formed, but it's also used to prevent them after big surgeries like a hip or knee replacement. You'll also see it used for certain types of heart attacks and as a bridge to protect patients who need to temporarily stop taking their daily blood thinner pills for a procedure.
And you can see here the dosing is super specific to the job. A small, fixed dose might be all you need for prevention, but if you're actively treating a big clot, you're going to need a larger, weight-based dose. That kind of precision is what makes it so useful. But this all leads to a really, really critical question. If this stuff is so good at stopping clots, what happens if a patient starts to bleed or needs to have emergency surgery right away?
And this is one of the most important takeaways. Unlike some other blood thinners, there is no magic off switch. There is no perfect antidote to just completely reverse its effects.
Now, doctors can give a drug called protamine sulfate, but it's not a complete fix. It only partially neutralizes enoxaparin's effects. It basically takes care of the small bit of thrombin activity, but doesn't really touch the main anti-XA action. That's why being careful in managing bleeding risk is so important with this drug.
But even with that limitation, you really can't overstate its impact. It has truly become a cornerstone of modern medicine. Its predictability, its convenience, its safety profile, it has saved countless lives from devastating blood clots. You know, the story of enoxaparin is just such a great example of medical progress, of taking a powerful but blunt instrument and refining it into a precision tool. And it really makes you wonder, what other everyday drugs are out there just waiting for a similar, smarter upgrade? Thanks so much for joining me.